Dr. Ramaiah, chairpersons, ladies and gentlemen, thank you for this opportunity. I have nothing to declare. We know that failure of SAC regression after EVAR is an independent negative predictor for survival. Investigators have preemptively embolized the IMA and the outflow vessels. However, this has been associated with increased procedure time, fluoroscopy time, and much more use of contrast. In this analysis of 5-year outcomes from Japan, these investigators showed that there was decrease in sac diameter. However, type 2 endoleaks was still fairly high, as summarized in this particular slide. Type 2 leak of 28% at 5 years, and no difference really in reintervention for the type 2 endoleaks. Then we had our own VQI analysis, which basically showed that there was significant difference in diameter change, but no difference in sac regression, rate, endoleak, reintervention, or mortality. What about preemptive aneurysm sac coil embolization? Yes, this has been done as well, and it does lead to regression of the sac. However, by the time you put in all these coils, there's absolutely nothing you can see. So it's easy to say that there's no endoleak, but who knows? On the other hand, when you use the shape memory polymer plugs, these provide a high volume filling of the AAA sac. It generates stable clot formation and thrombosis, improves post-procedure imaging visibility, as shown here, increases the rate of sac regression, and reduces AAA-related reintervention. And over the long term, hopefully, will lead to reduced costs and surveillance burden. This is a soft, conformable polyurethane foam, which goes in compressed, expands within the body, provides a scaffold for stable clot formation, and it produces a radiolucent material, which is easy to evaluate, and over the long term allows cellular tissue ingrowth to fill the sac completely. In this, Dr. Massmann, he was a German interventional radiologist who identified these 18 patients who were at high risk for type 2 endoleak and implanted these Impede FX coils with 100% technical success, and noted that within 3 months there was about an average 11 millimeter reduction in sac size, and there was sac regression even in the presence of small type 2 endoleaks, and more importantly, there was no morbidity or mortality related to this treatment. We then had Andrew Holden from New Zealand and a gentleman from the Netherlands who did the AAA shape safety and early feasibility trial, and showed that in these 35 patients, there was 100% technical success with no procedure or device-related adverse events, and there was very impressive decrease in sac diameter and particularly in sac volume, all done with minimal addition of fluoro time and contrast. So in my own experience here at Innova Fairfax, I have Alto is my stent graft of choice. Many of you will ask why. Because it does have the broadest IFU applicability. It goes through tortuous iliac vessels. It can treat short necks. It has the lowest profile of any device in the market. The trade-off, as Sean Lydon has shown us, is that it has a high type 2 endoleak rate of 41%. So I felt that using this graft along with shape memory polymer, I might be able to achieve the best of both worlds. So this is generally you upsize the contralateral access by 2 French. You can use a 12 French dry seal from Gore, and then deliver the main endograft as well as the ipsilateral limb. You place the contralateral limb after you've left a wire within the sac. Then over the sac, you advance a 6 French Ansel sheath or a destination, whatever your choice. And here you can see on the right, when you deliver these plugs, they actually move in real time towards the outflow. And that's so encouraging to see that they're actually migrating to where the problem might be. And so I'll show you a few cases that we've done. This is a patient with a 5.4 centimeter infrarenal abdominal aortic aneurysm. You see the alto graft in place. There's the guide wire for sac access. And these plugs have been delivered. And over the 1 month, 6 month, and 1 year, there has been progressive sac regression with no endoleak. And at 1 year, we are down by almost a full centimeter. Another case of this woman with a 5.2 centimeter aneurysm. Initially, there is slight sac expansion. That is just from the volume of the plugs. But by 6 months, it has substantially diminished. And by 1 year, again, almost a full centimeter a drop in size of the sac. This is a 7 centimeter nasty aneurysm that I did. Unfortunately, I had some access problems, which is why you see those Gore VBXs on the right-hand side. Deployed the graft and then delivered the plugs. And this gentleman has had the most impressive regression over time. I just imaged him a few days ago, and it's down to 6 centimeters. So these 3 cases highlight use of low-profile endografts in challenging anatomy. Aneurysm failure to regress is a significant problem. Active sac management is an important addition to EVAR. Coil embolization has had varying outcomes. Polymer-based aneurysm sac management appears to have related to increased rate of sac shrinkage. And these cases all appeared in the JVS CIT January issue, for those of you who wish to follow it further. We have a randomized control trial underway. Many of you are probably participating. And we have a 2-to-1 randomization, up to 50 sites, 40 in the US, 40 outside. And the primary efficacy endpoint is looking at sac volume reduction and no adverse events associated with this extra step. So, ladies and gentlemen, we have the next phase of AAA management, which is sac management, which we have so far ignored, but I think in time will be a pivotal, important addition to what we have done so far. Thank you. And Tom Lewis from the company is here for those of you who wish to know more about this technology. Thank you.